Pregnancy past your due date. Is it dangerous? Is it safe? Why do some pregnancies go past the due date? And as an OBGYN, how do I feel about it? What are the guidelines? What are the recommendations? Do you have to be induced if you're over 40 weeks pregnant? Hey, what's up everybody? Welcome back to my YouTube channel. On today's video, I'm going to discuss pregnancy past your due date. As an OBGYN, I'm gonna give you all of the information, all of the up-to-date recommendations and guidelines, and also talk about risk factors as to why you can go past your due date. In case you're new here, I'm Dr. Allie, I'm an OBGYN, and here on my YouTube channel, I share mostly about pregnancy and women's health, but I've also been sharing vlog videos, a day in the life with an OBGYN, and I also did a unboxing video because I love luxury bags, I'm obsessed. So anyway, if you're not already subscribed, please go ahead and hit that subscribe button so that you can become part of my family here on the internet. So if you follow me over on Instagram, then you will know that at the start of 2022, I started doing weekly Instagram live videos where I do Q&As and answer your guys' questions about certain topics. It's been so much fun to do these live Q&A videos, and I also save them, so if you want to check out old ones, you can over on my Instagram. So far, we've covered topics like twin pregnancies, tubal ligations, gestational diabetes, heavy periods, so a large array of topics. Recently, someone requested that I do an IG Live on pregnancies past your due date. I thought this would actually be a really good topic for here on YouTube because I already have videos talking about the first, second, and third trimester, the postpartum period, so why not talk about when pregnancy goes past your due date? In case you haven't seen those YouTube videos, I'm gonna leave them linked down below. All right, you know what time it is? Let's jump into the intro and start the video. Before we can actually start talking about pregnancies that go past your due date, let's actually talk about the beginning. What is your due date? How do we come up with your due date? This is something that's called an EDD, or an estimated due date. So it is just that, estimated, because no one can actually predict when your baby will come. So how do we calculate an EDD? This is actually going to be off of your last menstrual period, also called an LMP. If you know anything about OBGYN land, we put acronyms for everything and shorthand everything. So remember, EDD, estimated due date, LMP, last menstrual period. So we use your LMP to get your EDD, and we use this as a way to follow the pregnancy and make sure that the baby is growing appropriately. Now, in the first trimester, we always like to get a first trimester ultrasound to actually confirm that your LMP is matching the growth of the baby. So during that first trimester ultrasound, your doctor is going to measure the length of the baby. If the measurement of the baby is within 5 to 7 days of the EDD from your last menstrual period, then we won't change the date. If the fetus at that point is measuring significantly smaller or significantly bigger, then at that point we might change your due date. All right, moving on. The average length of pregnancy is 280 days. Remember this for trivia night. Or 40 weeks. And this is counted from the first day of your last menstrual period. All right, now let's jump into definitions. A pregnancy that's between 41 weeks and 42 weeks is actually called a late-term pregnancy. A pregnancy that's 42 weeks and beyond is called a post-term pregnancy. So what can cause a post-term pregnancy? Honestly, this is really unknown, but we do know that there are certain risk factors that can cause you to have a post-term pregnancy. One of the reasons could be that this is your first pregnancy. Your body's never done this before, and so first-time moms are more likely to go past their due date. Next risk factor is that you're carrying a male fetus. We know that male babies are just a little bit more stubborn. I'm kidding, but we know that male fetuses tend to have post-term pregnancies more often than female fetuses. You have a history of a post-term pregnancy. Like with most things in medicine and most things in our land as OBGYNs, if it's happened in a previous pregnancy, it is more likely to happen again in a subsequent pregnancy. So what are some potential risks if you have a post-term pregnancy? This could be risk to the mother or risk to the baby. Now I want you to listen up here. There have been multiple studies showing that these potential risks can occur, but these problems only occur in a small number of post-term pregnancies. So I don't want this to cause panic or worry or stress. I previously made a video on pregnancy over the age of 35 where again, I talked about risks, factors, and things that could potentially go wrong. And on that video, I had a lot of comments about women being panicked or worried or stressed out after watching that video. Here in my channel, I am here to empower and educate because I think it's important to know this information. And as a patient, you have the right to know all potential risks and all potential benefits of anything in medicine. Not having this information and not having all of the data, I think is potentially dangerous and honestly worse. You should be able to make an informed consent or an informed decision, so you have the right to know everything, even the parts that can be risky and scary. But then I also know that people like to live in denial and would rather not know the bad stuff, so I understand that side of it as well. But again, my job as a physician is to share this information with you all. Obviously, I share it with my patients, and now I'm sharing it with you on YouTube. Got a little sidetracked there. So anyway, like I was saying, most women who have a postterm pregnancy go on to have a normal, healthy delivery and a normal, healthy baby. But let's quickly go over some of the risk factors associated with a post-term pregnancy. One is macrosomia, or a large baby. Your baby might also develop post-maturity syndrome. Post-maturity syndrome refers to that the babies are then born with a long, lean body. They have a lot of body hair, longer nails, wrinkly skin. The baby might also have meconium. Meconium is when a baby has a bowel movement in the uterus. So the longer you stay pregnant or a post-term pregnancy, the higher the chance of the baby having a bowel movement while it's still inside. This could eventually lead to that meconium, or that poop, getting into the baby's lungs, which could then lead to infections and difficulty breathing for the baby. Another risk of post-term pregnancy is decreased amniotic fluid. Having less fluid can actually cause the umbilical cord to pinch and then ultimately lead to decreased blood flow to the baby. Because of this, there's also an increased risk of stillbirth. Again, I know stillbirth is extremely scary, and a lot of the things I'm talking about are scary, but remember, this only happens in a small number of women who have a post-term pregnancy. Also, we see an increased incidence of assisted vaginal delivery, whether that's having to use a forceps or a vacuum to help deliver the baby, or ultimately there's an increased risk of having to have a C-section. There's also a higher chance of infections and a postpartum hemorrhage. So I'm sure people are going to ask, so Dr. Ali, you just listed off a lot of scary things. So what should we do if you have a post-term pregnancy? Is there additional testing or something we can do? And the answer is yes, you should definitely have more testing if you're going past 41 weeks. Your OBGYN or your medical provider should be offering twice weekly testing. In some cases, delivery or induction may also be recommended, so make sure you talk to your provider. The tests that we do are non-stress tests, or NSTs, and BPPs, or a biophysical profile that's done with ultrasound. Now, when we do a non-stress test or an NST, we are measuring the fetal heart rate versus uterine activity for a span of about 20 to 30 minutes. And the result of the test can be reactive or non-reactive. With the NST, we get so much valuable information by watching that baby's heart rate. The babies let us know if they're stressed out or if they're doing okay. When we do a BPP, or a biophysical profile, on ultrasound, we're looking for several different things. We're measuring the amniotic fluid, we're looking for movement, tone, and breathing on the baby. If you're past 41 weeks and something looks concerning on NST or on BPP, your provider at that point might recommend induction. Now, if you're past 42 weeks, ACOG, or the American College of OBGYNs, does recommend induction of labor after 42 weeks. This is because the risk of stillbirth significantly increases past 42 weeks. We see an increase in perinatal morbidity and mortality. So going past 42 weeks, not recommended. All right, you guys, that brings us to the end of the video. I hope you found this video helpful, and I hope you learned something new today. As always, I'm gonna leave all of my social media linked down below, from Instagram to TikTok and my blog, which I write in Spanish and in English. Make sure you hit that subscribe button if you're not already subscribed so that you don't miss one of my videos. Thank you guys so much for always showing so much love and support. If you have another topic that you want me to cover here on YouTube, please leave me a comment down below. I love you guys so much. Always remember to be kind and show love to everyone around you. I hope you guys have an amazing week, and I'll see you on my next video. Bye.